What are kick counts? Kick counts are a way for you to assess the overall well-being of your baby. We do that by putting your hands on your stomach in a quiet space. Maybe you've eaten something and you feel for your baby's movements. So any movement, whether it's a roll or a kick or a punch, it counts as one whole movement. You want at least 6 in a 2-hour time frame to know that your baby is doing okay. Now, do you have to do kick counts every single day? The answer is no, you don't. You do kick counts if you're worried or concerned that you haven't been feeling your baby's normal movements, right? So you get to know your baby's movements, you get to know their schedule a little bit. Lots of babies tend to move around in the mornings when you're just getting up, and then you're probably distracted throughout the day and may not feel your baby moving a ton until around dinner time when you start to settle down. Now, if you're not feeling what you're used to feeling, then that's a good time to find a quiet space, eat if you haven't eaten in a while, maybe drink something cold, put your hands on your stomach and feel for those movements. If you haven't gotten 6 movements in a 2-hour time frame, then do contact your care provider. How will we assess your baby if you are concerned about your baby's movements? It involves a non-stress test. A non-stress test is something that can be done in a clinic setting or a hospital setting, and it involves putting monitors on your stomach. One of those monitors is going to be looking at your baby's heart rate, and the other monitor is going to be looking at any uterine activity like contractions or Braxton Hicks and that kind of thing. We're really concerned about the one that's looking at the heart rate because that's going to be able to tell us if your baby is actually doing okay. There's lots of different components that we see in a heart rate tracing that will let us know that your baby is doing all right. Now, if there aren't enough things that we're seeing there, or there aren't enough positive things that we're seeing, then we'll let you know and make a plan for further assessment as necessary. So up until 28 weeks, that is just time for you to get to know your baby's normal movements. There are no specifics in terms of when you need to assess, how long you need to assess, just get to know your baby's movements. After 28 weeks, that's a point when you do want to have at least 6 movements in any 2-hour time frame. Does that mean you have to actually check for your baby in any 2-hour time frame? No, it doesn't. It just means that you know your baby's normal movements, you expect your baby's normal movements throughout the day, and if you are concerned beyond that, that is when you're going to sit down, find some time to do your kick counts. Now, it is really important that if you haven't gotten 6 movements in 2 hours of time, and you are already concerned, do contact your care provider. We really want to stress that you don't want to wait an extra hour or 2 hours or even 3 hours waiting to see if your baby does perk up. It's best to just get things checked out a little bit sooner.